you're gonna do this video with a hat on?
Yeah, I like
this
the
is
hat.
your
It's
new
me.
Frank Sinatra look. I
Yeah.
love it.
How
I
about
love
you
it.
wearing this leopard
Leopard,
outfit?
yeah, well, I'm hot, you know. What could I say? What are you talking about today?
Well, this is a TruSculpt fleX.
Two-stroke flex. I used this on a patient of mine the other day. She thought she needed a tummy tuck. When I examined her, she didn't have any loose skin. She didn't have any fat. She just had loose muscle from having the baby. After she had the baby, the muscle was so loose, but she was skinny and she didn't have any excess skin. So we gave her 3 or 4 treatments with the flex. We tightened her abdominal muscle. It looks as though she had a tummy tuck.
And also for this man, they like to have it done as a 6-pack. You know, it shows
to develop their 6-packs, without going to the
without
gym.
going- gym.
Yeah, this is the easy way to do
and
it.
And we had a patient who had the butt
Oh,
lift.
she wanted butt lift, but she had no fat to suction. So, she was, otherwise she didn't want to gain any weight because she was a jock. So what we did was we gave her the flex treatment, and we lifted her butt, we increased the buttock muscle, and it looks as though she had a Brazilian butt lift without any surgery.
And this really, it's an amazing machine because it strengthens the muscle, it gives firmness, and it gives a tone.
You're right. And it's as you get older, especially I had one patient, a menopausal patient, whose arms were tightens the biceps, triceps. If you got some hanging muscle or the abs, this really will tone you without
and especially
doing
the
surgery.
thighs, if you want to have a strong thighs.
Yeah.
And also it's very important with latest indication is people who are bedridden and they have after surgery, spinal surgery, they will increase their muscle tone.
I had a patient who had hip surgery, and because she wasn't as active, this really tightened up her leg muscles. She couldn't go to the gym. She couldn't walk. She was sort of debilitated for a while after her hip or knee surgery.
The good thing about this is that you can use for big muscles, the small muscles. There's no pain with this. There's a muscle contraction. There's no burning. There is no side effect.
What is the optimal treatment plan for this?
The plan is, for example, if somebody hasn't exercised in the past, use the prep mold, which is prepare the muscles for the treatment. And 2 treatments like that.
That's for people who are not very toned. So you want to get them
prepared for
to
it.
Tone the muscle.
And then the second week, you give 2 treatments of tone, which increases the tone of the muscles. And during the 3rd week, you give 2 treatments of sculpt, which will make the muscles very strong, very powerful.
If a person is pretty buff, though, you could probably skip the prep mode and go straight to the sculpt if they're in good shape.
Yes.
Like the patient of mine, she was a jock to begin with. She was very toned muscle to begin with, but she wanted to emphasize the buttock muscle. She wanted the effect of a Brazilian butt lift without the surgery. So we went straight to the tone or the sculpt.
Yeah, and
she got an excellent result. What a difference.
And you can repeat that 6 months later to make it...
Well, for maintenance,
For maintenance,
maintenance
As you get older, you lose your tone. And
I love this.
Yeah, this is really amazing machine. It's approved by the government, by the FDA, and it's safe. It doesn't cause any problem.
And this is the newest cutting edge technology.
Yeah, there is no other instrument like this in the market.
You know what? It's a lot cheaper than doing surgery. Okay,
and it's safer too.
And it's a lot safer.
Yeah.
And it's a lot quicker, and there's absolutely no downtime.
No
you
downtime
don't lose
at
any
all.
time from work or school or your daily activities, your parties,
you can have it done in the office and go back to your work or
the same day.
to school, whatever you want.
A lunch hour treatment.
Yeah, exactly.
Okay, I think I got some patients going.
Okay. Thank you, Dr. Chobanian. Thank you. Thank you. Bye bye.
By the way, I like the Frank Sinatra look. The hat is very chic.
Thank you.